Truth 360 by BDC. I'm going to apologize in advance because I'm just a little under the weather. I keep thinking I'm healthy, and you go out and you get moving, and then you're like, you're not quite at 100%. So I'm about 80% today, and Jennifer has joined us on the phone. Hello, Jennifer.
Hello, Holly, and I am sending you big love and hugs and hoping that you feel better. I've already prayed for you.
Thank you.
It's just a process. So
it is just a process that I am trying to rush. Well, I want to welcome our... I'm trying to rush my way through it. Me and my clients. They're all like, you're still sick? What? No, we need you.
But you know what, Holly? The mark of an exceptional person is in the ability, despite whatever personal challenges you have, to do and perform excellently. And you have a power-packed show today.
Oh, boy.
Mental health. And so I just want to say big up to Holly being sick.
Oh, yes.
You roll sick, sweetie.
Absolutely.
We know how bad you are when you're well.
And you have to hurry and get here because not only is it Powerhouse with mental professionals, but it's Powerhouse with our favorite people, the AKAs, because you know how we do it, Soror.
What?
Because we shamelessly promote our own people. I mean, we love everybody, of course, but we shamelessly promote. Hey, that's what you have a show for, right, Jennifer?
That's exactly why you have a show, Holly, and why not have sorors who are phenomenal, outstanding, exemplary in all of their credentials, not just in the mental health capacity as professionals, but above and beyond.
And so that's exactly what we have today. They are credentialed, but more than that, they are fabulous. And we're going to have a little bit of all of them on today. But before, let me invite people to join us here at Truth 360 by BDC. I am your host, Holly Holiday, and I have my co-host on the phone, Jennifer Jones. Truth 360 is brought to you by Black Dress Collaborative. It's a high-energy weekly interview, debate, and commentary show that uses passion and music and humor and anything else we can find to talk about the issues of the day with a mix of brutal honesty, non-judgmental perspective designed to educate and empower all of our listeners and ourselves. Right, Jennifer?
Absolutely. We get as much out of the shows, and today is one of those days, Holly, I have all kinds of questions.
Oh, boy, me too. I have to tell you, we already have one of our guests in the studio. We're expecting one more, and another will be joining by phone, so it's going to be power-packed. Of course, you can always join us, be a part of the conversation by texting Truth360 to 40691, following us on Twitter or Facebook or Instagram at Truth360 by BDC. And, of course, email is always an option at Truth360 by Black Dress Collaborative. Jennifer, that Final Four, what did you think?
Oh, my God, Holly, you know I am on absolute cloud nine because that team with 4 freshmen was led by one of the loves of my heart.
I know.
That I watched grow up. And you know, just a few weeks ago in the studio, when we got off the air, Quinn's mom just happened to be crossing the street.
Yes.
One of our sisters in Delta Sigma Theta Sorority Incorporated, and my former neighbor, Jane Cook. Shout out to you, and all my heart, love, and energy goes to Ted Cook, who passed and left us in 2008. And I know he was looking down from heaven saying that my baby was a superstar in AAU, a superstar in high school, and despite losing his father and all of the setback and pain that came from it, Holly, he hung in there, stepped up to be an exceptional leader for a team of phenomenal freshmen to walk and usher Duke into an NCAA championship.
Woo! Go Blue Devils. I tell you, he was fabulous. And you know, the DMV is known for producing great basketball stars, and Quinn Cook did not disappoint. Even though he only scored 6 points during the championship game, he made some critical moves as point guard that opened up the field that allowed them to take their team to victory. So we are really excited about Duke and their championship, and most especially about hometown favorite Quinn Cook for being a leader on the team. So,
Absolutely, Holly. So I'm walking in the studio right now,
well,
and
while you
I'm
do
so
that,
proud to shout out. So
all
you go
right.
ahead and tell me, Holly, what's on the hot plate for you? Because you know you are my news extraordinaire.
Well, of course, we continue to push for the confirmation of Loretta Lynch. Even though Congress is in session, now that they're at home is when we really most need them and most need you to reach out to your congressional leaders, particularly those in the Senate, and let them know that it has been 5 months, people, 5 whole months, and we still have not confirmed Loretta Lynch. It is an absolute travesty. We must get this done. So today, if you're on Twitter, and you know I am, at 11 o'clock earlier today, we did what's called a Twitter storm. And you will have seen thousands of messages from across this country advocating and pushing our United States Senate to bring the Loretta Lynch confirmation to a full Senate vote. They pushed it off before the break, but when they come back, we need to know and we need to make sure that it is their first order of business. So that is absolutely tops on my list. Jennifer's in the studio looking at me, and before we go to our break, I do have to mention one more thing, and that is, folks, we had another cop shooting of an African American unarmed man in South Carolina. And, the travesty about this is, of course, don't think you can get away with anything in this day and age, because I promise you it's on video. And that's what happened in this case. The neighbor actually was filming this whole thing when a 50-year-old black man, unarmed, was running away, and a cop who happened to be white shot him 8 times in the back, dead. Really, even after the man is down and he continued to shoot and he approached the body, there really was, it was just difficult to watch someone's life end so tragically. At this point, he has been arrested on charges of murder, although not right at the scene, but at this point he's been arrested, so we will definitely be keeping our eye on that. This comes on at the beginning of when we're now also advocating, and we'll be advocating on Capitol Hill April 23rd and 24th for during our Black Men and Boys Conference. And it's just these kinds of issues that we want to talk about, these kinds of disparity in our criminal justice system. So if you're a black man or boy, please go to your Eventbrite and sign up to be a part of the Black Men and Boys Day on the Hill. We need to let the congressional members know that these kinds of activities require closer scrutiny, and we will not continue to let our boys and men in our community be slaughtered. I hate to end on a sad note, but I will let you know as we go into our first break and we talk about mental health that in 2014, in November of 2014, Cambridge University released a study that said that there are key songs that hip-hop has produced that improve your mental health. And we will be playing those top 4 on that list today. And it might surprise you which songs made the list. First up, Juicy by the Notorious B.I.G. for your mental health. We'll be right back. And we're back, and you can see we got a house full of fabulous ladies.
And I didn't even get the memo Holly put on my spring green.
Yes, well, we trying to work it out with our pink and green.
Worked it out with our pink and green and black.
We worked it out.
Wow, Holly, what an exciting start to the show we had. So now it's time to introduce our awesome and amazing panel of guests.
Boy, and not only do we have the two young ladies with us in the studio, we have one joining us by phone, and we're talking today about mental health, and specifically we're going to be talking about a program that we're having on Saturday, which is the Alpha Kappa Alpha Sorority Incorporated's Mental Health Impact Day. Is Saturday, April 11th, and of course, as good AKAs, we wanted to promote that.
Absolutely.
But also, we've done shows on mental health before, and we're very interested in just making sure that the community and that our listeners are really engaged around their mental health. And so we're pleased to have three great experts. I want to say the Mental Health Awareness Program that will happen this Saturday is being hosted by the three DC AKA chapters, which is Xi Omega chapter, Xi Zeta Omega chapter, and Rho Mu Omega chapter. And today our guests are Reverend Phyillis Cureton, Theresa P. Donaldson, DePass, and Dr. Maikeisha Bates, who's on the phone with us. Let me give you, because if we don't do a fabulous introduction,
gotta do a fabulous
the people would think that we don't know. They'd be like, "What show is that?" They gave that lame introduction.
Exactly. They have to do the Truth 360
So we have to do the Truth 360 introduction. So we got three people, so I'm going to get through it, but I got to give it the...
Take a deep breath and go for it.
Okay, here we go. First, Reverend Cureton is to my... What is this? This is my left. Maybe you're right. We'll figure it out. She's a native Washingtonian who's earned a BA in economics from Amherst College and an MBA in general management from Harvard Business School. She spent many years in the corporate sector before finding her calling in 2003 because she knew that God was not interested in her earning another degree or leaving the state.
Absolutely.
And then God took her to Tulsa, Oklahoma. So much for what she thought God was saying. She had to listen again. Exactly. He had to give her the real deal. And there she got introduced to the work of being a chaplain. She got assigned to field work in trauma-based hospitals, and she moved several times during that experience. ultimately earning a Master of Divinity at Oral Roberts University in 2007. She currently serves as the staff chaplain at St. Elizabeth's, St. E's as we call it affectionately here in the district, and became a member of the clinical member of the Association of Clinical Pastoral Education. In 2012, she attained board certification from the Association of Professional Chaplains, and she is an ordained elder at the Greater Mount Calvary Holy Church, which is a great institution here in the district as well.
Absolutely.
Of course, she's a member of Alpha Kappa Alpha Sorority, because that's how we're rolling today, and she serves as our chair of our Mental Health Awareness Committee. Thank you, Reverend Cureton, for joining the show.
Thank you.
All right. To my right, the dynamic Theresa Donaldson, DePass, has over 30 years of experience in the field of mental health. She is currently the program director for Mental Health Services Division of the Department of Behavioral Health, where she is responsible for a team of nurses, social workers, psychiatrists, and other mental health professionals. MHSD is a safety net services for citizens in the District of Columbia, and in 2014 provided urgent care services for over 4,000 consumers, ensuring their mental health needs were met. She has extensive experience as a trainer and facilitator and has literally worked all over the world, making sure that people understood and were trained for mental health education. This includes Jamaica, South Africa, just to name a few. Ms. Donaldson is a member of the Emergency Response Team in the District of Columbia. She holds a Bachelor of Science degree from Howard, which of course I have to mention because that's my alma mater too. And we support HBCUs here as well. And a master's in social work also from Howard. She's a licensed independent social worker and a certified public manager for the Center of Excellent Municipal Management, School of Business, Public Management, George Washington University. We are so happy to have you.
I'm happy to be here.
And also a member of Alpha Kappa Alpha. So there you go. House full.
Welcome.
And because we don't want to miss, and we have her photo on the phone joining us, is Dr. Maikeisha Barnes, who's an officer with United States Public Health Service, Commission Corps, and a psychiatric mental health nurse practitioner. There she is. Beautiful. She has experience in child and adolescent psychiatry, adult psychiatry, geriatrics, forensics, and addictions. In addition, she's an adjunct professor at the Uniformed Services University of the Health Sciences in Bethesda, Maryland, and an adjunct assistant professor at Howard University in Washington, D.C. She graduated cum laude from Wake Forest University in Winston-Salem, matriculated at Case Western University in Cleveland, Ohio, earning a master's in nursing and a master's in public health. She also has her doctorate in nursing practice. She was the first nurse to complete the Cleveland Veterans Administration National Quality Scholars Fellowship. She's a published author and has conducted numerous presentations of her research on African American males, quality improvement, and mental health. She's actively involved in the community in both Maryland and Virginia, where she volunteers as a mentor to adults and youth, motivational speaker, and just all-around active participant. Yes. She's, of course, a member of Links Incorporated, and did we need to say that she's a member of Alpha Kappa Alpha? We do. We need to say that. And she's been recognized in 2014 by the National Black Nurses Association Military Nurse of the Year, amongst many other honors. Dr. Bates, please welcome to the show.
Thank you, ladies.
All right. Do we all feel fabulous?
We all feel fabulous.
Yes. Well, I think if we're going to be talking about mental health, we definitely need to have that. And I'm going to have the first question go to Reverend Phyillis. Reverend Phyillis, tell us about this weekend and what we can expect.
We want to invite everyone to join us at St. Elizabeth's Hospital in Southeast Washington, D.C. for a free event that is going to help those who are looking for resources and awareness on mental illness and mental health. We also will have doctors speaking with us. about some of the critical issues facing our communities. And we will have a panel and a presentation by the National Association on Mental Illness, which is known as NAMI, who will also present that day. So please, we invite everyone to come out. This is a free event, and it is for all of our good.
Perfect.
And the event is going to be held in the atrium of the
auditorium.
Go right ahead.
It's of St. Elizabeth's Hospital. It is actually very accessible via public transportation on the Green Line Metro here in D.C., the Congress Heights stop. And you just have a picture, government ID, and you can walk through the gate. If you're driving, please come over to 1100 Alabama Avenue Southeast, right off of 295. It's a quick, easy drive.
Absolutely.
Perfect.
It's a wonderful campus,
Yes.
spacious campus, a lot of positive things going on at St. Elizabeth's campus. So if you have not visited the campus and you've not been to Southeast St. Elizabeth's with the Rise Determination Center and all of the development going on from the GSA and FEMA, it is a beautiful place to be.
Yes.
And so I want to make sure that I share with people, this is not the St. Elizabeth's from 20 years ago.
No.
Beautiful and safe campus.
And safe campus.
It's safe
That's
campus.
Right. That's
Absolutely.
Right.
Can I also say, a lot of people think St. Elizabeth's is closed.
Yes, they
Yes,
do.
they
And
do.
a lot of the buildings were abandoned for a variety of reasons, but we built a brand new state-of-the-art facility in 2010
Yeah.
Perfect.
and moved into it. And so you will be pleasantly surprised. So we want you to come and visit and get acquainted with mental health.
Thank
Absolutely.
you. So, Theresa, tell us, why is it important for people to attend this event?
It is important because, as you know, African Americans suffer disproportionately in terms of their mental health, and they are not as apt to go and seek help. So if you're a caregiver, or if you think you may be suffering from mental illness or just some emotional disturbance, this is a place for you to come and to get more information and how to get help for your mental health.
Absolutely. Dr. Bates, we have you on the phone, and thank you for joining us. Thanks
for having me.
What can people expect to learn at the event?
Oh, there's so much for you to learn. Actually, we, as Phyillis Cureton said before, it's an opportunity to hear the doctors that will be there speaking. We have two dynamic speakers there who are also members of Alpha Kappa Alpha, so they will actually be talking about mental illness and mental health in children and adults, along with suicide prevention. In addition, NAMI, which is our national collaborating partner now as of March 17th, will be there, and they will have volunteers that will show a video and actually talk about how they have overcome the challenges they've had with mental health diagnoses, and just speak on some of the things that have happened with them. So it's a great opportunity to not only come and hear some great information, but to receive the resources and just hopefully become more educated about certain things surrounding mental health. We hope to talk about, we will, not just hope, but we will be talking about depression and anxiety. Those are some of the topics, along with suicide prevention. And Phyillis mentioned before that it's an opportunity. I think that was Theresa who mentioned that it's an opportunity where you will actually be able to hear some great things about it, but to actually talk about some of the things. It's an opportunity to ask questions if you have those, to hear information, and we hope to not only educate, but work on decreasing the stigma of mental illness and improving mental health.
I'm so glad you brought up the stigma. Absolutely. Because so many of us, particularly in the African American community, think mental health is something that happens to somebody else.
Absolutely.
How do we start to deal with that and break that down a little bit?
Well, I think that is perhaps the single most important thing that we need to focus on is the destigmatization.
Yeah.
I believe, and across cultures, you will find that when there's a mental illness, they will think, they will somaticize. They'll say it's not really, they would not attribute the problems they're having.
And suggest that to have challenges, that you're weak, that it's a lack of a personal
especially
strength,
among African American women.
Exactly,
especially among African American women. And so it is important for us to understand and recognize what mental illness is, what it is not. And it's okay to go to your physical health practitioner, but also when you have identified that you have a mental health problem, to get the appropriate treatment and go to the appropriate person to receive that treatment.
And so we spent some time this summer and we did a show on the stigmas attributed to mental health. And so in terms of the destigmatization, and I want to follow up on something that you said, when you go to seek, how can you give like 2 or 3 or 5 examples of how a person comes to, because she's an expert, so I know she can like when how do I know when I'm actually having a mental health challenge? Because I'm convinced not only is there a stigma, but there are also internal barriers that I don't know that my life is kind of leaning to the left. When I have a pain in my chest, when I have abdominal pain, when I have a joint pain, I know to go to the physical. So what kinds of signs and symptoms should people be aware of to say, hey, you might need a checkup?
A pervasive sadness that doesn't go away. You go to the doctor, you have a pain, and they can't find a physical basis for that pain. Inability to get up or not wanting to get up in the mornings. Not able to sleep. So there are signs that will guide you, that you'll know something, I'm off. And sometimes you're so off that people will notice it. Your inability to concentrate. Your inability to perform the activities of daily living, not wanting to get up and take a bath, or just do the things that you do or would normally do on a daily basis.
Beautiful. That's beautiful. And so I know Holly was pitching to you because you, being in ministry, add another layer, especially for African American women and women of color overall, but I think all women and individuals, about our faith. And mental health. That you know what it is. Girl, if you got some mental problems, you're not praying right, you're not living right.
That's right.
And you need some oil and some scriptures.
Well, and I will say, I'm not going to throw the baby out with bathwater.
Absolutely.
So we do still need some oil and scripture.
We need some oil, some scripture, and some prayer.
And prayer. Yes. And we need one another.
And one another, right.
But we have, I think, as the church, particularly the charismatic church that has an evangelical roots, some would say holiness, Pentecostal, perhaps even more the mainstream churches have often poo-pooed seeking help for mental illness, even poo-pooed the biological, physiological effects associated with it as something that's spiritual or demonic or something of those natures. And it has been researched much more recently that there are biological factors that impact us.
Sure.
Everything is not biological, but many are. Most are.
Sure.
And I have said to many who have approached me as a spiritual provider in this field, which is somewhat controversial
and unique.
I have said that one can have diabetes and we'll go to the doctor and seek help and get medication and try to follow the proper regimen. Now, if we start to experience headaches or social withdrawal or depression that lasts for far more than 2 weeks or 2 months, or any of those suicidal ideations, we for some reason think that we should just go to the church and pray. I would suggest that you do go to the church and pray, and then as soon as you leave there, you go directly to a mental health provider or a center to seek additional help. There might be a biological reason for those feelings.
Yes. I remember. Oh, I'm sorry. Go ahead.
No, and I might add that there might be a biological, but when you go to a proper mental health professional, they will first rule out.
They will rule out the possibility.
Exactly.
Absolutely.
And so, Holly,
I was thinking when I was growing up, around the dinner table, particularly at holidays, the elders at my family, we used to call them the cocoon crew, because after the meal was being cleared, they would sit and talk about all their medications and what they're taking and what doctor they've seen and that sort. And I wonder, and this is to Dr. Bates, how can we help make talking about mental health part of our kitchen table issue? What do we need to do to infuse that into our dialogue with our families?
Well, I think the media is doing a great job by incorporating it into TV shows that we are all watching and are very familiar with, bringing up those topics so that people can ask more questions. I remember after watching one show, there was a dialogue on Facebook about the signs and symptoms and how people are affected. Also, making sure that you talk to your loved ones about it. You hear about mental health in so many different arenas. When we're talking about our children, you hear about bullying, and our kids are depressed. Our kids are not sleeping. Our children are having anxiety. And then when you progress to older teenagers, of course, there's stress related to that. They're being a teen itself, and then having to deal with friends and things that are going on in the world. So making sure that you talk to your children, making sure you talk to your other family members, asking them how they're doing, and listening when they tell you. Those things are important. Another fact that was brought up before was about having a mental health provider. I will be very honest and say a mental health provider, you have to find the right one for you.
Yes.
That means talking to them, interviewing them, knowing what you are looking for, and listening to what they are saying. The healing process is a process that happens between the provider and the patient or the person who is receiving care, and you have to be an active person in seeking care and actually getting care. So when we're having these conversations like we are now here on the radio, when we are having things like our Mental Health Impact Day at St. Elizabeth's and bringing people from throughout D.C. to Southeast D.C. to St. Elizabeth's, those are the ways to start those conversations and hopefully to open up doors when people take the information back home and are just looking at a brochure or pamphlet and can say, what do you know about this? Or have you felt this way? Or honey, what do you think about this? And reassessing those things. When you're having those physical ailments, are they truly physical ailments, or are they physiological signs of something else that's going on mentally with you?
Dr. Maikeisha, you bring up a good point in speaking about even how adolescents feel or react to mental health. Can you tell us a little bit about, as we age, what are some of the different ways mental health can affect us?
Well, as I talked about children and adolescents, but when we're adults, we're taking on different stressors with life. We're talking about our jobs. We're talking about our families. When you reach, especially, and I'm going to bring up women specifically with this, as caregivers, you're sometimes left taking care of your children and also taking care of your older parents. So you have to think about caregiver burden and caregiver stress with that. As you age and turn older, I mean, there are different life factors that are affecting you. You're losing your loved ones because you're getting older. There are changes in your own personal health that you have to handle within yourself, which can lead to anxiety and depression. And making sure that you have those coping skills in order to handle these things, and making sure you have a support system that you can talk to can be helpful as you age and you progress in the different aspects of your life.
And Reverend Cureton, there's something as a PK and as a person who has a very powerful growing to the MD ministry going on. I know the kinds of challenges that we see, and I think you did an exemplary job of saying, yes, pray, yes, have your faith, which we believe in, and also care well for yourself. And something that Dr. Bates just mentioned about workplace and adult stress. So I want you to step back, if you can, into your corporate life. You are Morgan Stanley. You're a true corporate executive with an exemplary background. Scott Paper Products, American Express, Financial Advisors, Freddie Mac. And often in the workplace, we see, especially among women, but it happens between all genders and all ages, all kinds of work stress and dynamic going on that have very little to do with the job.
Right.
And so I often walk around and say, she needs a couch, she needs a couch. You know, my day, I need to break a couple of plates. So talk about just kind of lifestyle things where you, as you talked about, a program director, where you know something's not right. Right. And you're getting all these signals that you keep having, combating issues with people, you know. Absolutely. So talk us through some of that.
I'm torn because I want to talk about the youth.
Yes.
And I also want to talk about women.
Yes. So go right ahead. We got time. Is our friend.
One of the statistics that NAMI has provided is that youth, 1 in 5 youth between the age of 13 and 18 will present with a mental illness of some sort.
Yes, I believe that.
Be that anxiety, as Dr. Maikeisha mentioned, or grief. Think about how many people are dying who are young.
Yes.
Yes.
And
the what you talked about, dying. I mean, our young men having to walk around, and you know, my son called yesterday and said, Mom, I'm kind of bored. He's on spring break. We're not going anywhere yet. And he said, I want to do something. And I said, well, I was going to say, you are at the National Harbor. Boy, get out and go take a walk. Right. And then I thought, no, that is not smart. And I said, you know what? We will come and scoop you up.
Wow. Right.
Do you understand what I'm saying? Just because I have anxiety about my beautiful. And so I know they do too because they've talked about it.
And often now this anxiety is so deep-seated, they don't know how to express it. They become risk takers. They become depressed. They become, you know, there are lots of different ways to express these things. And we have one of the speakers that we have on this coming Saturday works with the school system to help programming for kids who have been potentially identified as needing help. Yes. And there are a lot of them. So we're just happy that our DC public school system is aware enough to be able to set up a program with Department of Behavioral Health to start to help these children. But so there are many, and we have to, they're not coming to church, y'all.
Right. And so do we want to talk about and stay on youth for a moment? Teresa, do you have some?
I'm sorry, because one of the things that will be affected is their school performance.
Okay.
And you will find that there are young people whose performances is affected, and what will happen, they will say this is a bad child. This child is not performing well, and they will go the way to the guidance counselor for quote-unquote bad behavior instead of looking at the deep-seated cause of some of the problems that the children are experiencing. Truancy may be a problem. They may be living in homes where there is drug abuse, where the parents are too depressed to even be a parent to them, and they bring all of that to the school.
And you know, one of the things that I want to ask you is about the resource piece. Mm-hmm. You've done a lot and worked with a whole team of different mental health professionals. How do you know which one you should go to, who you should reach out to? How do you differentiate between all the choices?
Well, I think after a while, the teachers are not there to teach. They're there for the academics. However, they are the first line of defense. They will notice that something is off with that child. And it then becomes, I don't want to say their responsibility, but they're the gatekeeper. They can then send the child to a guidance counselor. If there are times when a child is going to be unhappy at home, but it is not going to be a sustained kind of behavior. But if that child is constantly depressed, constantly sleepy, constantly aggressive, aggression is also a sign of depression.
Because you talked about risky behavior and acting out.
Then that is your clue to begin to get that child some assistance.
That's right.
And it's a scary thing. And Dr. Bates, you may want to share with us. I know that just the process of rearing teenagers, right? So my children are amazing, fabulous young men. And as they have gone through their experience as teens, I remember going through my process with my older son. And so my girlfriends, I would call them and have a girlfriend's chat. This is what's going on. And they would tell me, oh my God, you're so horrible. Oh, Jennifer, how could you feel that way about your own child? And I'm saying, I'm thinking about putting putting the kid in like one of those 2-week programs at Inova, let them assess him because something is way off. And so I had a sister who said, love him through it, exercise patience, wisdom, and discipline. And I did. But you don't know in the moment. And then I'm watching all my girlfriends whose children are now going through their teens. And they're like, oh my God, I want to kill him. I want to choke him. And it's like, no, pause for a moment. So how do you know what the line is?
You are identifying what is known as a support system. You have to have a social support system because I experience the same thing.
Yes.
And you'll find you're not able to speak to that child.
But your
friend is able to speak
that's
because it's not as
That's
emotionally charged.
I had a girlfriend who I can tell you, big shout out to Rhonda Caldwell, Angela Merlet. I got a whole list of you and Holly Holiday. And I watched at my oldest son's graduation. I was so moved to tears that all of my friends gave him their card, and when they spoke to him and said, and you don't have to tell your mama when you call. So it was the circle of support because I'm 1,000 miles away from family. So that's powerful. That's powerful. So we talked about young people.
But it's also important, I think, to recognize the sign. As you know, I had foster children as teenagers, and both of them experienced extreme mental health challenges. One of them ended up being diagnosed as manic as well as bipolar, and was undiagnosed up until really right before she went to school, and only I think really was fully diagnosed because she was an athlete and had a heavy routine, but when she got injured and that routine was broken, everything kind of came out at that point. And so I think,
So she had masked it, Holly, or
she had a stressor that precipitated that.
Yes.
Absolutely. And I think that can happen in that way. But then my other foster daughter was very different. I think she was I think the first child who was bipolar, I think she had always been bipolar, had always been manic, had always shown extreme highs and extreme lows, but because of her disciplined schedule, she that worked as kind of a control mechanism, and because her highs were so high and so great, and she received such praise for them, that the lows were somewhat ignored.
That it was excused.
It was excused because she would come back and do something, I mean, out of this world. Out of this world. But and so, but my other child was very much a stressor. She was dealing with, coming out as a gay person and the pressure of that. And this was 10 years ago, so it was really bad pressure. Then. And dealing with the rejection of family and stuff like that. And so those kinds of things, you do see a lot of help for. I mean, there's suicide lines and there's, immediately facilities. I mean, you kind of know what to do. And I think the harder thing, though, and I'm gonna start with Dr. Maikeisha, is what do you do for those kind of less easy to diagnose? Just those malaise and the anxiety and the stress
and the depression and the zoning out into social media,
which so many people write off as, they're just being teens.
Yes, absolutely.
So I just want to say about that, as a parent, you know your child better than anyone.
Yeah.
And if you're on that fine line and you're not sure, reach out and find a mental health provider and take them to be assessed. I have to admit, I've worked overnight in the hospital, and I've had parents bring in children because they had broken up with their boyfriend or girlfriend and were suicidal, or the parents felt like they were suicidal and did not feel safe having the children at home. Rather, and which I appreciated, have brought that child in and let that child sit and talk to me for 20 to 30 minutes in the emergency department, or however how long it took, and had a professional diagnosis or an assessment done, than having the child at home and not sure. Because sometimes, even when you think it's going to be okay, it's a very different day and time, and you can never quite know. So if there is ever a question, I would say take your child to the nearest emergency department if it's an emergency and have them assessed, or find a provider that you trust to assess your child.
Yes.
And Dr. Bates, can I just ask a couple more questions? That I remember having a friend tell me, but you don't want to take your child to be assessed because then he'll have mental health challenges in his medical record. What kind of concerns should parents and guardian adults have about that issue?
Well, that's once again one of the stigma issues that keeps people away from seeking mental health services. And I'm not just talking about children, I'm talking about adults in many different professions.
Yes.
If there is a thought that if you have a desire to be whatever desired profession, that you will not be able to do so if you have a history of mental illness or have been seeking mental health services at any point. What I can tell you is, because I can't speak on professions, but I know even in the military world, what has helped the stigma the most is for some of the for some of the enlisted officers to see higher ranking officers there receiving assistance. Mm-hmm. I mean, it's not a bad thing to do to seek help. As I think it was Ms. Cureton said, if you had a problem with your diabetes, if you had a diagnosis with something going on with your respiratory system or any other of your body systems, you would go seek help for that.
Absolutely.
Getting help for any mental condition is helping you. It's better to receive help in the short term than having long-term effects and then having things happen that we would not want to happen.
Now, you mentioned something that I don't think a lot of people realize, and that is that you can receive emergency mental health services. And you can access those through emergency rooms or where?
When I spoke about coming to the emergency department, I am in the uniformed services, and so I saw patients on a military base, and those were active duty and the dependents of those who were active duty who would bring in their loved ones for an assessment. Uh-huh. Now, let me remind you, one of the first things that happens when you come in for a mental health assessment is you have to be assessed physically to make sure there's nothing physically wrong with you, because as we've discussed, sometimes things that are physical conditions can have mental health manifestations, or it can be something that's physically going on with you.
Sure.
So if you're diagnosed with a chronic illness and you get depressed related to that, then we know that depression is related to your diagnosis. But there may be other things that are going on. But if at any point in time there is a loved one in which there is a crisis, then yes, you should take your loved one to the nearest emergency facility. In addition, one thing that I always have to bring up, if anyone is ever having thoughts of harming themselves, please make sure you are familiar with the Suicide Prevention Lifeline at 1-800-273-TALK or 1-800-273-8255. It's crucial that you have those numbers and you are aware of these things, because a crisis can occur at any time. And if you already have the information, then those resources become very helpful at that time.
Thank you. Theresa, you want to say?
Yes, I wanted to add that there are also illnesses that mimic a mental illness.
Yes.
So, for example, you can have some mental illnesses related to diabetes.
Yes.
It can demonstrate some of your mental illnesses. Or you could have Alzheimer's and it will look like or you can be doing drugs and it looks like a mental illness. So you have to rule out there are medications.
Yeah, like if you take prednisone, it's one of those that it makes you very aggressive.
Exactly.
And it changes the behavior dramatically.
Exactly. So there are those kinds of medications that will look like or mimic the symptoms of a mental illness. So you really do have to get that ruled out before you can certainly diagnose someone with a clear and persistent mental illness.
Well, Holly, it's the top of the hour.
It's
I
the
can't
top of the
believe the time is flown by.
We have so much
Reverend
more to
Cureton,
talk about.
Exactly. I'm coming back so that you said you want to talk about young people, you want to talk about women. So we finishing young people. Y'all get no more time. No, I'm kidding. We'll go back and recircle, but come back. But let's go, Holly. You were talking about the songs that promote mental health, the hip-hop contribution to mental wellness.
Yep. And number 2 on that list is I by Kendrick Lamar. So here he is.
a peace of mind. A peace of mind, one nation, under a groove.
Woo! We are back. Well, we were having such a rich conversation off the air, which always happens. So now we got to bring a little bit of that back to the air. We are back with Truth 360 by BDC. There's so much to this conversation, and we only have another 20 minutes or so to get through it all. But we were talking about music, Theresa, and you have done and worked with mental health professionals all over the world, so you've seen the impact of music in many ways.
At St. E's, there used to be music therapy.
Oh, there still is.
There still is music therapy. And in certain countries, there is drumming. Just the rhythmic drumming is very soothing. If you listen to Bob Marley, that music was born out of a struggle, and it was a way of expressing. And so when people get involved in that kind of music, they are actually relating what their pains, just the pain of living, what that is. And so music can be very, just dancing dancing, listening to music can be very, very therapeutic.
Well, a lot of music is born out of people's pain, and so by getting that out and expressing it, that's certainly a coping mechanism and a way to deal with it.
And it makes sense, Holly, when you think about not just classical music, not just jazz, instrumental music,
right.
but also I know for me, worship music can take me there, and more than that, like my song on Monday was "We Are One" by Frankie Beverly and Mays. Songs can pull me out of difficult moments, right? And so the power of music and a glass of wine, but the power of music and some water, let's be healthy, and some water really, really does work. So I really appreciate that you made sure to underscore the significance.
Okay, boy, we have a lot. Okay, women. We gotta go to women.
So we were talking off air about the challenges that somewhere between all of the things that make women as colorful as we are. I sum up most issues and challenges among women and with women somewhere between the ego and the esteem. And I was pleasantly shocked when Reverend Cureton said that she doesn't know which issue to address first, but all of it she sums up to be related to the esteem. So let's talk about it.
I see so much low self-esteem in females, which has led to behaviors that could be harmful to themselves or overcompensating. My colleague Theresa was talking about women being the caregivers, which we are.
Sure.
And sure, there are many men who are as well, but we tend to be the primary ones. And we care for so many others that we don't care for ourselves. We don't acknowledge the care that we need for ourselves. So I was just speaking with a woman before I came today who was very concerned about issues going on in her family. And I said, who do you believe is the Messiah? Everybody has a different, a religious belief, or you may have no religious belief, but who is saving you? Who is saving any of us? Now, I have a firm belief in Christian tradition, but as a chaplain, I'm trained to work with many different traditions.
Ecumenically.
So I try to respect, if you're a Muslim and you say Allah, wonderful. So what is your relationship in that spiritual system that helps support you and helps to buoy you and your family, your colleagues, your friends to another higher level? Part of that we find in our worship expression, which we tend to have lost in this country on a regular basis, on an ongoing basis. I will say the church is not perfect.
Yes.
The mosque is not perfect. The synagogue is not perfect. However, there have been some strengths that we found there that have helped our communities to survive.
Absolutely.
So while we may go through experiences like grief that may cause us to lose hope temporarily, in the Christian tradition, we know that we have something to look forward to. If that person was quote unquote saved, we'll see them again.
Absolutely.
And so we have a notion that there is even something greater coming, and that can help give us hope.
Yes.
So there are so many angles to look at what's impacting women. The over functioning almost becoming the Messiah in helping to care for others, but performing a critical role in caring for others.
Sure.
The low self-esteem often particularly in our younger people, who are some of the risky behaviors that we're seeing have to do with not believing in themselves as worthy or lovable. And how do you treat that? Is that an illness, or is just that a belief system that perhaps could be shifted through sisterhood? One of the things that I find best about the Alpha Kappa Alpha Sorority link is that there is sisterhood.
Yes.
I find as I age, our schedules are so busy when do you have time to connect with someone else? So that doesn't all point to mental illness, but it does point to a lack of support sometimes.
Isolation.
And to promoting mental health. I think that was very important, because that's something Holly is a huge proponent of mental health. Long before Truth 360, Holly was Holly, let me tell you about something that just helped me keep it in check, because I am blessings and rainbow, and oftentimes I'm one of those women who can overlook, like, okay, you were way out of order, but I'm going to give you a pass because you might be having a bad day. And Holly's like, no, don't give a pass right there, not right there. Address it. And so in that regard, let's talk about what mental health, what a healthy mental being or state is.
Well, I'm going to that lady over there.
All right.
It is, you're right, a state of well-being, the ability to forgive, the ability to first know yourself, the ability to be introspective, the ability to say, this is not mine, I'm going to deal with it right now with you, and don't take it on, because what happens, it builds and builds, and every drop will fill that bucket, and you will overflow. So you need to deal with things in real time, but you also need to forgive. You may decide that this is not... Thank you.
Amen. Mental health.
This is not something that I need to make a big fuss
Bless
about.
and release.
But you also need to respect yourself and to have others respect you. Because what will happen eventually is that you will keep taking it in, and then your self-esteem is going to be severely damaged.
And
because you're going to feel worthless because somebody will constantly disrespect you.
And I completely agree with you. What I found myself saying was, in leadership at times when you are a consultant, which means you're going into people's problems to solve it. So that's your niche. But there are times when I started to say, as a molecular biologist, the interstitial spaces between the cells in my body cannot take another person's burden. And so I need you to back off. So I find myself saying, post-divorce, teenage years with my kids, all of the things that stress us as women, the friends lost, friends gained, the work, the stress, all the things we want to do from our heart but don't have time. The time we should have said no, but we said yes.
Exactly.
All of those things can overwhelm us. It doesn't mean that we have a mental health illness, but it certainly means that we are infringing upon the self, the esteem, and our mental wellness. Yes. And so you really have to underscore that. Respect yourself. Maya Angelou said it, teach people how to treat you. Absolutely. So I love it. So keep going, Miss Theresa. I'm just taking notes. I'm going to say some
Dr. Maikeisha, I have to ask you,
absolutely.
Because you deal with military personnel who have to deal with extreme stress. What are some key coping mechanisms that we can all take from and need to learn to deal with sort of our everyday lives, which can be extremely stressful?
Well, I think it's very important that you listen to yourself and listen to your body. Know when you need to take that mental health day. Know when you really need to say, you know what, I just want to lay in bed all day and do exactly nothing, and take time to do that. And it's important to recognize that some days you are going to be great and on top of the world, and some days it may not be that great. But there's nothing wrong with having a not so great day. It doesn't mean that you're clinically depressed or anything like that. But as far as coping skills are concerned, exercise. I mean, we can't say that enough. Exercise. The endorphins that are released when you exercise make people happy. It's true. Eating a healthy diet. Sleeping, actually getting sleep. I mean, going and turning off the cell phone, turning off the television, and actually sleeping. All those things can be really important. Knowing when what makes you happy, what makes you smile. Is it going dancing on a Saturday evening?
Absolutely.
Or is it movie on a Sunday afternoon? Is it going to church with friends? But recognizing those things and having those girlfriends or friends that you call your support system. You may not want to call them your support system, but just having those girlfriends that you can pick up the phone anytime, day or night, and say, hey, this is what's going on with me. I just want to talk. I need someone to vent with, or whatever it is, words you decide to use. And go walk in the park. I mean, go just get out of the house for a moment. Turn on the radio, listen to some music, dance around. Those are all important things that you can do to cope. It's just realizing what works for you. And everything that works for one person may not work for another. Absolutely. But do what's great for you.
Yes.
I think this is so awesome, Holly. Like, I'm sitting here like, yes, because that's the whole Truth 360. It's to not just look at the problems, but to peel back layers of the onion to really get to core.
Yes.
Absolutely. And you may not be able, a vacation works.
Yes.
Stepping aside, putting away the day-to-day chores, the day-to-day burdens of life. But you may not be able to afford that,
Right.
but you can have a staycation. You can plan that this day, tomorrow, whatever, instead of just laying home and doing nothing, I'm going to do something for myself.
Yes, yes, yes.
I believe in shoe therapy.
Yes, Dr. T.
One of our the person who comes on right before us, big shout out to B Swinging, does too, and so much so that she features a shoe every show. I'm
There
not
you
quite
go.
her, but she's my shoe idol.
Yes, she is a shoe idol. And that's what I mean, I literally remember I worked at an office in Silver Spring, and I remember we watched the Discovery Building be erected, right?
Yes.
And my mental health joy was to walk from my office to Whole Foods, go look in the interior design store, and buy a tuna fish sandwich. I don't know why. It was just my joy. And cherries. And that
Absolutely.
entire spring and summer, every time it's like, oh, I'm recruiting and staffing, it's getting stressful. Let me take a walk.
Wow.
And in addition to that, you need to do something that makes you happy.
That's right.
Yes.
Have
That's
a hobby. Do something.
Yes.
It could be baking cakes. It could be
That's not
knitting.
it.
It could be
No.
anything that you do
Yes.
that makes you happy.
Yeah, but we're all
gonna
in
get
with
there.
you because
We're
I
all
tell
in.
people all the time, they say, you do so much, but I tell them the things that you see as work, I really enjoy. Like, I
Absolutely.
really enjoy. And so
Absolutely.
it's not work. There's nothing more rewarding to me than finishing a project, seeing the finished result, and knowing it. That brought me joy.
Right.
And
Well,
I hate to layer on another task for women because we have so many.
No, but it's good.
But
Come on.
do something to help someone else.
Serving.
Absolutely.
Yes.
Serving. That's it.
My motto in the Bible is Jesus, and he came as a servant.
yes.
He's a shepherd, but he's also a servant. So there is something about giving back. There's something about, especially when you do it, and it's not for the attention. It's not because
Exactly. It's
anybody
from a pure
told you to.
place.
Right.
Gratifying. And that's what
It
we
is.
do as Alpha Kappa Alpha women.
Absolutely.
You're always doing the
Absolutely.
next project.
Yes.
It's so gratifying to do something. You're absolutely correct.
And I told someone, I said, we all go through hills and valleys in life, right?
Yes, we
And
do.
through the valleys of losing a parent, death of a parent, divorce, all the tragedies, change, financial strife, all the things, I served. And so what you thought was me doing and not I distracted myself from my things as I worked through them
That's right.
by serving.
That's
And so it
Absolutely.
never looked ugly to you,
Right,
but people
right.
who were close to me knew, it's hard. But I had that support system, and shout out, that's why all my friends can call me. You want me to cook something, whatever you need. Because when I was in my valley,
Yeah.
I did these things. And Dr. Bates, I just want to tell you, I started my 5-mile run walk. I am having my 5th day. I stay on the treadmill or I move my body for an hour and a half,
my hero.
and I get my steps in for my mental wellness
my
and my
goal.
physical wellness.
Yes.
So health and wellness is important because we promote wealth, business, politics, all things on the Truth 360 show. But I so appreciate all of you that I'm going to send this list out after the show. Holly, send the
Absolutely.
list out.
We'll send the list out. But before we end, I want to just give all of our guests a chance to leave us with some parting thoughts and to make sure we have all the information on AKA Mental Impact Day happening Saturday, April 11th. So I'll start with Reverend Phyillis, and then we'll go to Sor Theresa, and then Dr. Maikeisha on the phone.
No one can fault you if you don't know better, but when you know better, do better.
Amen.
And we are here to help educate the community on mental health. We know I was giving out flyers on the day, and the flyers were going like wild cakes because
Yes.
so many people know people who need help.
Absolutely.
This is a free event that's
I
coming
forgot that part.
Saturday.
It's free.
Free.
It's free.
It's free, y'all.
It's free.
It's free.
Free. We would like people to sign up on Eventbrite. Look for AKA Mental Health Awareness. But even if you can't sign up on Eventbrite, head over to St. Elizabeth's Hospital, 1:30 to 3:30 this coming Saturday, April 11th. And I think it is a treat. Invite your friends to come. If they live in Maryland, invite them to come. It's just right down the street.
Yes.
The last thing I will say is Again, the church is not perfect, but it is a pillar in terms of finding a source of spiritual strength. If you believe in the mind, body, and spirit model, the tripartite model,
Yes.
And most people think about the body, when you're tired, when something hurts. We think about the mind a lot at St. Elizabeth's when something's not working right, or confused, or you're forgetful. But we don't think about the spirit. I would suggest that we need to grow the spirit. Yes. And if we have an imbalanced trifold model, then something is askew. So let's feed ourselves spiritually, and there are different ways of doing that. But I implore you to please.
So I'm hearing a future show, Holly, on feeding the spirit.
All right,
beautiful.
Now. Theresa.
I want to leave you with this. It is not your fault if you have a mental illness. It is not your fault if you have cancer. It is not your fault if you have diabetes.
Wow.
Similarly, if you have a mental illness, it is something in your brain. Treat it as such. Do not let other people tell you that you're a bad person. That is something that you need to be ashamed of.
Yes.
Seek help, and seek help early. I do want to say briefly about cultural competence. There are nuances to us as African Americans, and so we handle things a little differently. So seek, if you can, someone who's culturally competent to provide you with services. And come out again on Saturday and receive all of the learning that you can about mental illness.
Dr. Maikeisha Bates, wrap us up.
Well, just to wrap everything up, I am a true believer that you may be disappointed if you fail, but you're never doomed if you don't try. So
Lovely.
Make sure that you're always taking care of yourself. And we as women love to make sure that others are okay. But as they tell you when you're flying on the airplane, put on your mask first and then help the person beside you. Once again, I want to remind everyone about our event that will be on Saturday, April 11th. I want to thank all my sorors for this wonderful conversation that we've had today. And that in itself is promoting mental health.
Amen. Well, thank you to all of our guests. We will have this up this weekend on our bonus content. Go to the Mental Health Impact Day on Saturday, and then check us out again on this show on YouTube on Sunday, and you'll be completely filled, and we'll be having a lot of good information. Thank you to our guests. We're going to wrap this conversation up with the number 3 mental health feel-good hip-hop song by Grandmaster Flash, The Message.
All right.
Awesome.
Went out today already.
It's like a jungle sometimes. It makes me wonder how I keep from going under. It's like a jungle sometimes. It makes me wonder how I keep from going under. Broken glass everywhere. People pissing on the stage, you know they just don't care. I can't take the smell, can't take the noise. Got no money to come around, I guess I got no choice. Rats in the front room, roaches in the back. Junkies in the alley with the baseball bat. I tried to get away, but I couldn't get far. 'Cause the man with the touch up repossessed my car. Don't push me, 'cause I'm close to the edge. I'm trying not to lose my head. It's like a jungle sometimes. It makes me wonder how I keep from going under. Standing on the front stoop, hanging out the window, watching all the talk about ruin as a baseball. Crazy lady living in a bag, eating out of garbage bills, used to be a fag hag, such as the tango, spent the life in dango, was so concrete, just seemed to lost her senses. Down at the peep show, watching all the creeps, so she could tell a story to the girls back home. She went to the city and got so sedated, she had to get a pimp, she couldn't make it on her own. Don't push me, 'cause I'm close to the edge. I'm trying not to lose my head. It's like a jungle sometimes. It makes me wonder how I keep from going under. It's like a jungle sometimes. It makes me wonder how I keep from going under. My brother's doing fast on my mother's TV. Says she watches too much. It's just not healthy. All my children in the daytime, Dallas at night. Can't even see the game. Say what? It's like a jungle sometimes. It makes me wonder how I keep from going under. It's like a jungle sometimes. It makes me wonder how I keep from going under. A child is born with no state of mind, blind to the ways of mankind. God is smiling on you and he's frowning too, because only God knows what you go through. You grow in the ghetto, living second rate. Your eyes will sing a song of deep hate. The places you play and where you stay looks like one great big alleyway. You'll admire all the non-book takers, thugs, pimps, and pushers in the big money makers. Driving big cars, spending 20s and 10s, and you wanna grow up to be just like them. Smackers, scammers, burglars, gamblers, pickpocket peddlers, even panhandlers. You say cool, I'm no fool, but then you wound up dropping out of high school. Now you're unemployed, all non-void, walking around like a pretty boy. Flood turned stick up kid, but look what you done did. Got sent up for an 8-year bid. Like a man who the street and you're a make tag. Spend the next 2 years as an undercover flag being used and abused to serve like hell. Till one day you was found hood dead in the cell. It was plain to see that your life was lost. You was cold and your body swung back and forth. But now your eyes sing the sad, sad song of how you live so fast and die so young. So don't push me, cause I'm close to the edge. I'm trying not to lose my head. It's like a jungle sometimes. It makes me wonder how I keep from going under. It's like a jungle sometimes. It makes me wonder how I keep from going under. Yo, man, you see that girl, man? Yo, that sound like cowboy, man. Money? Yo, it's building Raheem, man. Cooling out. Yo, we can go down to the people, man. My mom, man. I get it, man. Hey, don't nobody move nothing. Get up, man. We down with that. Fast and the Furious. Come on, man.
Woohoo!
What
Well,
a
are we
great
mentally
show.
healthy?
Oh, Holly, I'm telling you, between the music and the conversation, it's not your fault. Seek help early. Take care of yourself. And when you know better, do better. Mind, body, and spirit. If something's off, check it out.
Well, you know, I had to go through and think through, like, just, you know, I always reflect when we do these shows about the coping skills that I have in my life.
Yes.
And I have a staff person who works for me. And, you know, I think she's going through a few challenges. And I had to say to her, you know what, you need to talk to somebody. Because, you know, you can't always find what you need and get what you need at work.
No.
And by talking to your coworkers who are there to do a job. You really need to seek professional help. And that's really what helped me. I mean, from the age of 12, dealing with my father's addiction issues, up through 18, and then a few times in my 20s and 30s as well, just getting some refresh.
Absolutely.
And a lot of it is just about understanding what your triggers are, what your tools
what your
are,
buttons are.
And you don't know that until you explore it.
And you really, and to know, like, Holly, what I appreciated about my mental health experience was the rigorous assessment that's done to get a baseline of where you are, to really hear you out before, and that's when I think Director Theresa said, make sure that you find a good fit. You know, go to the place, because I can tell you I still love my first therapist, because he told me these are your buttons and your triggers.
Yes.
Protect yourself. And it has been like guiding principles with which I know this is going south.
Absolutely. And I think, you know, when I think about what I would say to another person, I would say if you have not in your lifetime had some type of mental health assessment, that you should seek to do so.
Right.
Because part of knowing yourself is understanding those triggers and understanding what coping mechanisms may work for you. Many of us, unfortunately, we're going to we don't live in a vacuum, so we'll develop some way of dealing.
Right.
Unfortunately, many of those ways are unhealthy. We turn to alcohol, we turn to drugs, we turn to food,
behavior.
We might turn to exercise, and not that exercise is bad, but anything in extreme can be bad. And when you don't understand why you're drawn to something, we could be drawn to unhealthy relationships.
Absolutely.
We can be drawn to anything that we're using
and recreating
to
the comfort zone, and sometimes your baseline is not healthy. And so I'm a big believer in what things can you do daily, weekly, to promote mental health in your life, because having rough patches and challenges and sorrowful days, bad times is normal, but it's how you handle it. And when you are overwhelmed, get help. Like, that's my big message, because I was really proud that my father, as a minister, as a theologian, his real mindset was to say, hey, I believe in counseling. I believe in therapy. And he was ahead of his day 30 and 40 years ago in the church, in the faith-based community. So I'm just excited to see the needle move forward. And I could tell you today, I'm leaving today's show feeling like uplifted and on fire. I don't know if it's my little 5-mile challenge to Jennifer or what, but
absolutely. Well, I think it's all a part of it. And again, I encourage people to have a mental health assessment done. If you've never had one done, this is a great time to start thinking about that. It is another way of learning more about who you are. And as we heard from our experts today, that is key in being able to understand how to manage through some of those things that happen to us. And some of it can be situational. You may find that you have a genetic disposition to certain things. So having that in-depth assessment is very critical. And if you haven't ever had that done, then you definitely should look for an opportunity to do that. The good thing is most health insurance plans will pay for some level of sessions, and so it's important to kind of seek that out. The other thing that was said by Theresa is find the right mental health professional.
That's it.
Think about who you are and what you already know about yourself, and find somebody who is a match for you. Because there's a lot of quacks out here, unfortunately. Just like in anything, there's a lot of people who are just not good for anybody. And then there's people who are just not good for you that may be great for somebody else.
Absolutely.
So you really also need to think about an interview and match someone who's a good fit for you. Think about the cultural competencies, think about the age, think about the things that you're dealing with, and whether or not they have experience in dealing with those types of issues.
Absolutely.
Do some research to figure out and get some recommendations to figure out who would be a good fit for you. But I think if there's any two things that I'm walking away with, it's definitely seek to have a mental health assessment, and the second is find a professional that works for you. Because you may not use them every day. You may not even use them every year. But, just like Jesus, it's good to know that they're there.
Absolutely. And Holly, I am really excited. We talked earlier about Duke. And there's a beautiful article on the internet about Quinn Cook, and about how when Quinn went to DeMatha, one of the most highly sought programs in the country for high school students to play basketball, he was a bit of a superstar. He had won national titles with AAU, been on teams that have been very successful, and he is a phenomenal athlete. But during the time from him being at DeMatha to this NCAA championship, Quinn had a major loss. Ted talked about this child. They had pictures of him at 2 years old dribbling a basketball. So for him to lose his dad, as it would affect any of us, and being a kid, his dad was at the core of basketball. I remember when Ted used to take teams of kids. We used to have fundraisers to fly the kids to AAU tournaments. And so Quinn went through a period where his coach and his mom sat down with him and said, we need you to be a leader. And he made a decision pro Quinn. And so that's what I'm taking away from today's show. You can make a decision to be so pro you that you get yourself in tip-top shape. All of us go through hills and valleys, but really, really, really those things of exercise, eating a healthy diet, sleep, sleep in the right hours. I didn't realize, because I used to have the luxury of working for myself on my own time, how much I was sleeping around the clock. And so what to other people looked like I never slept, it's like, no, when you're up and in traffic in the morning, I'm sleeping. Now that I've become a day person, it is like, you know what? I have to sleep, get all my sleep at night. So I have to get my 6 to 8 hours in. And I think another was making sure you do things like a staycation, a vacation, and I call them micro joys. Find something that makes you happy. For me, it's a glass of Pinot Grigio. From the time I get the glass to smelling the aroma, it brings me joy. And so brie cheese brings me joy, right? And so I'm just a promoter of joy. You always jokingly and realistically call me rainbows and blessings. But I really do kind of live in the space like, okay, that was real horrible. It's over. Let's go on to next, to be up and at 'em. And it's not a panacea. It's just, I think my parents did a great job, Mom. And to my dad, God rest in peace, that they did a great job that no matter what kinds of challenges were going on in the home, in our lives, or in the community, they always made us feel like it's safe when you go home to Irwinville, Louisiana. There is safety, love, joy, laughter. I mean, I didn't grow up in a house where I joke with my friends, Saturday morning, you could stay in your PJs until about noon, 1 o'clock, and then people start saying, "You gonna get dressed today?" But we had because everybody had a fast-paced life, we had such an ability at home to sit and enjoy a meal, sit and talk, sit and laugh. And so I just promote, get some joy in your life. Try Jesus.
Well, on the Jesus note, I guess we'll go to our Tupac.
That's
song.
right.
And it's the 4th song in the list of hip-hop songs that promote mental health improvement.
And I don't know if
well-being.
he's watching.
So
but
keep your head up, Tupac.
Tupac is my friend Brian Mitchell's favorite artist. So big shout out to Brian Mitchell and Tupac.
All right then. All right. Well, it's the end of the show, so let's run through some of these community announcements. I want to make sure we get everybody in, and we've got some important stuff, as always, coming up. One that's not on here that I'm going to speak to first is you can go to Eventbrite. It is the National Heal Day for Black Men and Boys, happening on April 23rd and 24th. The training will be occurring right here over at Howard University by former Congressman Kendrick Meeks, who's a fellow of the Ron Walters Leadership and Public Policy Center. And then we'll be taking it to the Hill. And this is really revolutionary because, let me just say, congressional members do not often get to hear directly from black men and boys. So if you are black male, ages 8 to 80, have any level of mobility or not, please make it your business to be on the Hill with us. We'll actually be on the Hill on the 23rd, and the training takes place on the 22nd.
Do you know Lisa is supposed to actually, Holly, be a guest on our show next week to talk about younger people's issues, and to talk more in depth about the boys event.
Well, we should actually have maybe the senior fellow on the show then, because I'm promoting the men, but I think men need to talk for their own damn self, because I certainly am going to be talking for mine. So this is Men and Boys, playing by men, for men, about men, particularly black men on the Hill. All right, first up, of course, what we've been talking about all day today, realities, resources, and recognition. April 11th, that's this Saturday at St. Elizabeth's campus from 1:30 to 3:30. You can register at Eventbrite. Just put in Eventbrite, realities, resources, and recognition. This is actually part of a national AKA Day on mental health. They're calling it as National Impact Day. So if you're not in the D.C. area, then you can be a part of National Impact Day in your community. Simply go on Twitter, hashtag AKA Mental Health Impact Day. That's AKA Mental Health Impact Day is a hashtag. And even in your area, you can find events that will be going on, because we're going to be doing this all over the country.
Yes.
Next up, one of our favorites here, Ingrid M. Turner, the Youth Empowerment Summit, happening at the Camelot by Marriott. Saturday, April 25th. That's 2 Saturdays from now. This is only $10. It's for youth. She does some spectacular things at this conference. What do we want to say? I mean, we've been talking about it for a while. It's entertainment, it's speaking, it's workshops, it's everything you need to know. She's going to be talking about health and wellness, financial literacy, leadership, which Ingrid is well known for. What year is this for her doing this conference?
I think this is the 4th one.
The 4th year, and they just keep getting bigger and better. Also on Eventbrite, it's pgc2015.eventbrite.com. $10. You should definitely check that out. Wrapping up is one of our favorites.
Yes, and Holly, I did not talk about and send. I actually just remembered that it's on my USB port. So big shout outs to George Frazier. But the Power Networking Conference, as you know, is happening in Dallas in June from the 25th through the 27th. A power-packed, absolutely awesome event. And I'm going to try to get this other slide on, but I'm going to share with our audience that there's a power talk, a free power talk tomorrow night, April 9th at 9 o'clock p.m. Eastern Standard Time. And this power talk is going to feature none other than Dr. Charles Ogletree. As many of you know, he's a Harvard University professor and scholar. I think he taught both Michelle and Barack when they were in school. Dr. Charles Ogletree is going to have a power talk to talk about the Power Networking Conference. It's an all-star preview series on race, justice, and equality. And what's so important, Holly, is that these are the types of dynamic and amazing people who are at the Power Networking Conference. We are so excited.
Well, I have to tell you, last week, which is probably why I'm sick, thank you to my nephew, my 7-year-old nephew. You know who you are.
Yes.
I was in Kansas City because George Fraser was the keynote speaker at the Urban Summit, and I had the chance to introduce him, which was truly an honor. I hope I did him justice. But let me just say, he lit the room up.
Yeah,
and,
he's amazing.
And let me just say, we'll be bringing probably 2 large delegations from Kansas City to the Power Networking Conference. And I told him, I said, now you all got to go to Dallas, but when he comes here to the Maryland area in 2016, I expect you to show up and show out. So let me just say, anytime you get an opportunity to either hear Dr. Fraser or any one of the speakers at the Power Networking Conference, you should 100% do it. I know that he was awesome talking about the purpose of connecting the dots in Kansas City, and shout out to the Urban Summit and Freedom Incorporated for them both committing to send delegations. Even in that room, Jennifer, he was able to recruit. I think when I took him, we actually left the event and went down to the Jazz District in Kansas City, and we were having gumbo of all things in Kansas City to have, and not ribs. But anyway, we had gumbo in Kansas City, and he was remarking that he actually got about 35 people to sign up on the spot to attend the Urban Summit. So we know there'll be at least 35 Kansas Cityans, and probably going to be another 2 delegations of folks coming. So we're really excited about that.
Absolutely, Holly. And, we have just been on a complete roll. George Fraser is going to be here at First Baptist Church of Glen Arden on Friday night at 7 o'clock. It's another free event on Saturday. There's going to be the Richards Foundation is going to host a boys' summit.
Wait, which Friday is George here?
On this Friday, April 10th.
Friday, okay.
This Friday, April 10th.
April 9th, we have the Power Talk.
Exactly.
April 10th, we have George Fraser. And then April 11th, we need to get our butts over to St. Elizabeth. We got a lot going on.
April 11th, there's St. Elizabeth's during the day. And then there's also going to be for young boys and men a conversation by the Richards Foundation that George Fraser is going to be pouring into young men about these challenges that they're having, the threats and attack on their life. So George is shamelessly pro-African American, shamelessly pro-business, pro-networking.
Absolutely.
He is amazing. But we have the flyer up, Holly, for the Power Talk tomorrow night. So you can call into 712-432-0075. Again, that's 712-432-0075. And the access code for the call is 271-542 and the pound or hashtag sign. That's 271-542 and the hashtag sound. I mean, what a treat to be able to listen to Charles Ogletree. They'll be receiving calls, and there'll be others on the Power Talk who are going to be featured at the Power Networking Conference. I am so excited about the Lisa Initiative and about all of our friends from First Financial Security are going to be a part of the Power Networking Conference this summer. And of course, today, Holly, we had another strategy and planning meeting for the 2016 conference. So mark your calendars. In May of 2016, the 25th through the 28th, we'll be hosting the Power Networking Conference here in Prince George's County. I'm so proud to be in partnership with the county, with many Prince Georgians who go every year, Sisters for Sisters Network, and all of our good friends, Holly. So we are all in the power of the network, the power of the talk, and all things Power Networking.
That's right. Well, that's a wrap for us today. Let me tell you, it has been just great having all the sorority sisters here. Absolutely. It felt like a whole Pinky Green fantasy. I want to remind people that, of course, we will continue to push our bonus content out. But in order for you to receive that bonus content, you've got to text True360 to 40691. Or check us out on our YouTube channel. We try to put the shows up on Sunday, if not before. So check our YouTube channel out with this Truth 360 by BDC. If you can't remember that, just remember Holly and Jennifer. If you put that in the YouTube search, will come right up. And, of course, follow us on Twitter and Facebook and Instagram at Truth 360 by BDC.
And, Holly, there's one more thing I want everybody to go and Google. I'll try to send to you. But big shout-out and big ups to the community of Ferguson for going beyond tragedy, beyond the march and public awareness, and going to the voting booths. Ferguson has elected 3 blacks on the city council for the first time ever. The 67% majority community has taken their voice to the voting booth. And now I want to see them go from voting to beyond the vote to legislative advocacy. So we'll talk more about that next week as well.
Absolutely. That's going to be a wrap for us. Join us next week, Wednesday from 5 to 7 at WLVSradio.com, and we'll be right back here having more engaging conversation.
Absolutely.
Big shout out to the show that precedes us. That's Be Swinging, for all your talk and all your information on authors. And, of course, stay tuned to the Renee Allen and Friends Show coming up next.